Back inside the sports bar, 610 the sports animal, Michael Carlisle, Mike Trujillo. Joined in studio. Looking forward to this. You know, usually I have to talk to you, Trujillo. Today I get to talk to a smart guy.
As to why?
Well, you get to talk to a smart guy every day.
Yeah, I tell.
Dr. Beau Hightower joining us here. Doctor, thanks for the time, man. So much we want to get to. How do you go from being a football player, you know, stereotypical old dumb football player, to being a world-renowned doctor, physician, and all-around smart guy?
Oh, that's a good question. I think you have to look in the mirror and say, maybe I'm not that good at football. Maybe I should probably, put my efforts towards something else and find some other passion. So that kind of led me down this route, and now I'm, working with the Jacksons and having a good time.
Yeah. For those who don't know, you played here at UNM, and you were here 02, 07-ish?
03 to 05, I was
03
here.
to 05, okay.
Mm-hmm.
Okay, so that was, so some good times there.
Strong years.
Yeah. You played under Coach Long then, right?
Mm-hmm.
Yeah, okay. Gotcha. And then, now you're putting that UNM degree and other degrees you've picked up along the way to good use, helping fighters over at Jackson's and a lot of other stuff. I've been really fascinated. Follow you on Twitter. I try to keep up with you because we had you on before and I found you really fascinating. But, some of your philosophies, the way you go about treating people, the fact that you seem to like to try to address the problem rather than just giving a patient something to mask the pain, novel things like that.
Right, yeah, that crazy idea of actually figuring out what's wrong with somebody. Yeah, so our philosophy is based on, looking at the musculoskeletal system as a functioning, living system. So when we talk about joint pain, we recognize that most muscles cross two joints. So say my quadricep crosses my knee and my hip. Mm-hmm. If that muscle gets too tight or it's fibrous or I've had an injury, what are the odds that I'm going to start having pain at one of those joints? Well, pretty high. So what we're doing is we're assessing the body and looking at the mechanics and understanding what somebody's doing in their life. And then what we want to do is fix it and then teach them how to take care of themselves. So we want to change the paradigm of musculoskeletal medicine, more like dentistry. So you brush and floss your teeth, and then you come in every 6 months when there's a problem instead of being hooked on, pain meds or having operation after operation after operation, which, takes you out of what you want to do in life.
Now, somewhat serious questions, somewhat tongue-in-cheek. When you're with other doctors and you're talking and everybody's talking about, this pharmaceutical company, I'm getting this, I'm getting that. And you're like, well, I try to just treat the problem directly rather than, do they look at you funny? But what about all the money you're missing out on?
Yeah, not really. It just depends on the person, I don't really associate with pill pushers per se.
Right.
So most of the surgeons that I talk to and the people that I want in my network are people that are more progressive and they want to look at the whole picture. And so they're really, all this comes back to is let's do the right thing for the patient no matter what that is. So if your ACL's torn, you should have surgery. Mm-hmm. You know what I mean? If you're in 10 out of 10 pain with nerve stuff, you should have Oxycontin. There's a place for everything,
Sure.
But when you just, you hurt your elbow, you go to the doctor, they shouldn't be writing you opioid pain medication right off the bat. That's a problem. It leads to deaths and it changes people's lives in a negative way.
Right.
Which leads me to the question about cannabis, and we saw Nate Diaz, for example, after UFC 200 when he or 202, after fighting Conor McGregor, he had the vaping. What's your stance on medical cannabis?
Yeah, and that's a tricky one, right? Because technically it's still a Schedule I nationwide, so federally it's still illegal. But I mean, I think we've realized throughout the years that prohibition doesn't work, and a lot of the rhetoric that we've heard out there is just simply scientifically inaccurate. The cannabinoids work very well. You're not going to die from them. The thing about opioids is they affect a receptor called the mu receptor in your brain. And what that does is it makes it highly addictive, and it also makes it likely, just like heroin, to stop breathing. So people die from it. I've never heard of anybody ever dying from a cannabis overdose. Maybe you eat some Cheetos or whatever else, but
right.
It's a highly effective, anti-inflammatory, depending on the way that you bring it into your body. So I mean, if you're smoking it, really we shouldn't be inhaling smoke in general, right? So like,
right.
The difference between water, if I vaporize this water, it turns into steam, but when I cool it back down, it's back to water again. If I burn up the chair, it's not the same thing, and the same thing happens with a marijuana cigarette. Mm-hmm. So there's ways that you can get those cannabinoids in your system that are healthier for you, so tinctures, edibles, and things like that. And in my personal opinion, obviously that's outside the legal jurisdiction in the state, is that it should be used a lot more broadly, and it should be accepted a lot more and thought about more by most doctors.
We're talking with Dr. Beau Hightower here on the Sports Bar, and this is something that comes up a lot when we talk about NFL injuries and NFL players getting addicted to pain medication and stuff like that. And I suppose we could transfer it over to the MMA side as well. Is it less harmful long term for using something like cannabis under a physician's treatment as opposed to, taking a handful of pills every day just to make it through the day and play on Sunday?
Based on the current research, I think we can safely say that for sure it's a lot less dangerous in the long term as opposed to traditional painkillers. Now, there are side effects to that too. Now, there is statistical correlation between cannabinoid use and schizophrenia. Now, they don't know what the causation is, and that's probably not causation. It's probably the type of person that would use cannabis tends to be that type of person anyway because it calms them. But it is something that we have to recognize in the literature. Now, again, they don't know any reason why that would be, but we can pretty clearly look at deaths from opioid overdose and then the transition into hard drugs, fentanyl and heroin and things like that. And our state has been plagued with that kind of an issue.
In terms of working as a doctor for Jackson Wink and working with athletes, in all the research that you've done over the years, is there something, a correlation in terms of the chicken and egg? Is it the medicinal things that are out there that are causing the changes in the body of these athletes, or is it vice versa? Is it just a matter of time? Is it some sort of evolution? I don't know. I'm kind of coming at it. Does the question make sense?
So is that a USADA question? Is that what that is?
Maybe, yeah.
Is that here's the thing, is that you've got the most highly competitive people in the world, and sometimes it's a 1%, 2% difference that makes the difference in somebody being a champion and somebody being run-of-the-mill. Look at Barry Bonds. Look at some of those guys. He was already the best baseball player, but he was seeing all these success and the money that McGuire and Sosa were getting out of that. And, these guys move up to the next level. So, the sport of MMA has cleaned up a lot, particularly in the UFC. Bellator, we don't really know. We don't really know where they stand on some of the drug testing, but you're seeing a lot of different outcomes than we had before USADA. And for me personally, when I'm picking fights, I have a lot harder time now because some of the guys and gals, they don't fight the same anymore. They don't have knockout power anymore, or they're getting knocked out quicker because they're not on some of those things that they were on before.
What's some of the weirdest things that you've seen? What sort of injuries that would be out of anybody's mind that you've seen?
MMA injuries?
MMA injuries.
Yeah,
or any for that matter in terms of athletes.
So one of our athletes just fought in this Invicta fight this weekend, Jody Escobar. She's a local, boxer fighter. Awesome lady. So she got caught in an armbar in the first round. Should have probably tapped, but she's got so much heart she fought through it and ended up winning, dominated the second and third rounds. But she came in the office yesterday and her arm is completely crooked. Ooh. So her forearm is basically sticking out at an angle. It's swollen. So we checked all the ligaments. Everything seems fine. We may send it for an MRI later this week. But essentially we said, listen, we've got to line this bone up with your upper arm and make sure everything's lined up properly to start with. That way it heals properly. And then we can see if there's anything else going on at that point. So that's a pretty weird one. You see a lot of broken hands and feet like you'd expect. Seen broken jaws, dislocated jaws, lacerations in the eyes. So what else do we see in fighting? I've seen one lacerated spleen. They walked in the office. I sent them straight to the hospital because you could die pretty quickly from it. Yeah, exactly.
What are the more common injuries? I assume things like facial bruising, cuts, above the eye and stuff like that. But what are some of the more common ones that you almost expect to see?
So some of them are similar to you and I, lower back issues, neck issues. So you can imagine wrestling, people are yanking on your neck all the time, like your neck's going to start bugging you. Some of the unique ones are going to be dislocated toes and fingers, a lot of shoulder problems from throwing punches. So we see this a lot with boxers and MMA fighters also. So they're always throwing those forward punches. So those muscles on the front are having to catch that motion over and over and over again. And they develop a lot more than the muscles on the back. So essentially what happens is the humerus rotates internally in the socket. So if you guys have seen any of those videos of me fixing those kind of things, they can't raise their arm up at all. And 5 minutes later they can because we externally rotate that bone back where it needs to be. And then they can strengthen the muscles to keep it there in the long term.
Michael did bring that up, facial distortion, things of that nature, the surgeries, the cauliflower ears.
That's a crazy one, right?
Yeah. Always been intrigued by that. Nobody really wants to see it, but everybody does, just like a horror movie.
Yeah, it's a weird thing. It's like a badge of honor for a lot of fighters. Right. If they wore headgear more consistently, they wouldn't have that, but they just kind of go with it. So there's a couple of female fighters, like Michelle Watterson always wears headgear because she doesn't want to have big old swollen ears. I mean, I wouldn't want to do it, but that's just me.
Yeah.
When I wrestled in high school, we always wore headgear. But a lot of these guys, it's a badge of honor. And, you ever see somebody out at a bar with cauliflower ear? That's probably not the one you want to bump into, right?
That's a telltale sign.
That's the guy you want to buy a drink for.
Yeah,
right?
Exactly. Now, are some people just more susceptible to cauliflower ear? Or?
Yeah, some people's ears are more susceptible to it. But essentially what it is you get these broken blood vessels in there and they swell up. So if you don't drain it right away, basically your body puts scar tissue down over there and it thickens. And so it just thickens and thickens. And some people, it closes all the way down to where they can't even hardly hear.
Oh, wow.
So then what they have to do is they'd have to cut you open and scrape all that stuff out, which not a lot of fun.
That doesn't sound good at all.
Yeah. No.
Look, want to talk to you a lot more about the stuff you do over at Jackson Wink. You got another segment in you?
Yeah,
We'll
absolutely.
take a quick break. Okay, we'll take a quick break here. We'll come back more with Dr. Beau Hightower next here on the Sports Bar, 610, The Sports Animal.
Sports Animal time, 5:10. Another look at traffic.